kuenda kama iko free. Hiyo chanjo ikiletwa saizi na wasiwe ni free, unaweza kubali kwenda kufanyia? Hautaenda. Kwa nini usiende? Hauna corona. Una corona. Okay, sema ndio hauna corona, lakini in future unaweza kupata vaccine.
Clinic OP is an effective digital tool enhanced for COVID-19 response to assist vaccine makers, health departments, and other stakeholders gather and process data, giving them the ability to make data-driven decisions and responses in the fight against the COVID-19 pandemic in collaboration with healthcare volunteers in their communities, particularly the youth. The COVID-19 pandemic has reminded us a very important thing. Information is power. When the pandemic struck, governments and health response teams tried their best to contain the situation while dealing with one big challenge: the lack of sufficient data about the pandemic to enable good and effective decisions. As a result, they ensured a series of blind brute force responses. Many mistakes were made. For example, we were told that face masks were not necessary. There was also much wastage and misallocation of resources. We have just concluded a pilot community mapping data collection campaign for COVID-19 vaccine preparedness, using Clinic OP to demonstrate the system. We collected data from over 5,000 respondents across all age groups and occupation in Mvita Sub-County in areas of Tudor, Makande, Shimanzi, and Ganjoni located in Mombasa County in Kenya. At 50% entry and processing the data seems to indicate the following. 1. Less than 50% of the respondents would be willing to participate in a COVID-19 vaccine trial. 2. Less than 40% of the respondents would be willing to participate in a COVID-19 vaccine trial given incentives. 3. Over 50% of the respondents would be willing to get vaccinated for COVID-19 if the vaccine were available nearby. 4. Over 50% of the respondents would be willing to get vaccinated for COVID-19 if the vaccine were available for free. 5. Less than 35% of the respondents would be willing to get vaccinated for COVID-19 if the vaccine were not made available for free. 6. Less than 35% of the respondents would be willing to get vaccinated for COVID-19 if given incentives such as money. 7. Less than 50% of the respondents would be willing to have their children vaccinated immediately if a vaccine were available today. 8. Majority of the respondents do not think we should wait for a vaccine in order to resume public political events, for example, a referendum. 9. Majority of the respondents would not attend a political event today, for example, a referendum or general election. 10. Majority of the respondents get information about COVID-19 from television. 11. About 20% of the respondents cited safety concern as the main reason against getting vaccinated for COVID-19. 12. About 15% of the respondents cited prevalence of fake information as the main reason against getting vaccinated for COVID-19. Many other interpretations and strategies can be derived from this data for better preparation and high-precision deployment of a vaccine to the community and other programmatic interventions. It will be accurate to say that we are now in the second phase and the long stretch of the fight against the COVID-19 pandemic, and we have learned two things. One, our biggest hope of getting the pandemic under control is to get a majority of the population vaccinated against COVID-19. Two, having endured lockdowns, curfews, and hard economic times, people are yearning for a return to normal despite the high risk of getting infected. Massive resources have been mobilized for vaccine development around the world at an unprecedented rate, and while a working vaccine is expected to be ready in a matter of months, for the moment we still do not have a universally accepted and reliable vaccine for COVID-19. However, what we do have is one very important thing: a bit of time. We have a bit of time to get our communities and populations ready for COVID-19 vaccination. We need to prepare our communities because COVID-19 vaccination will be the mission of the century to stop this pandemic that has slowed the world down to an almost complete standstill. The objective of Clinic OP community mapping for COVID-19 vaccine preparedness is to create a database of most vulnerable people in our communities and workers in occupations that present high risk of infection of the coronavirus. We are calling all stakeholders to partner with us now while there is still time and lend your support in capacity building and funding so that we can take this tool to the community youth, health departments, and volunteers for successful community mapping and vaccine preparedness campaigns that will result in effective and precise resource deployment and a majority of the population getting vaccinated in the shortest time possible as soon as a working vaccine for COVID-19 becomes available.
Some even thought that if the vaccine is administered to them, it will render them infertile. And I think sensitization should be briefly done so as to ensure that the public have a full understanding